Good afternoon, everybody, and good afternoon, Virginia. It is 4 o'clock, a time we come together 3 times a week right now. And remember, we're going to get through this, and we're going to get through it together. 2021 is going to be the year that we defeat the coronavirus. It's going to take months. We're still going to sustain heartbreaking losses along the way, but we are going to win this battle. We're going to win this battle because vaccines are here. The first two that have received emergency approval are highly effective, and I'm working day in and day out, along with the Department for Public Health and many others across state government, to make sure that we are getting them out faster, that we are building the infrastructure to provide more widespread vaccination, and that we are doing everything possible to make sure each one of you that wants a vaccine can get it as soon as they can. That is my primary mission right now, knowing that for many, that could be the difference between life and death. Today, I'm going to start with a vaccine update, go over a little bit of what we did yesterday, and making sure that everybody has seen the full list of priority. I think on Thursday, we're going to have either Secretary Friedlander or Adam Mather from CHFS go through the Walgreens CVS program, where it is, overall number of facilities in long-term care that have had received the first round of vaccination. And so we'll get a full picture of that endeavor on Thursday. So today we're going to go over some vaccine information. We're going to get today's report, and it's going to show you that coming out of the holidays, our numbers are wonky. It's really low compared to yesterday and even previous weeks. That's a good thing, but we're going to have to see what it means. Our positivity rate is still pretty high. And then Mark Carter is with us to give us a real evaluation of the contact tracing program. And I think you're going to see that having all those people fighting so hard to reach those that are infectious, to keep them from going out, to make sure that they get care, and then to quarantine those around them, have saved a lot of lives. And I'm very grateful for those in the long term and for those in the local health departments that have been doing this work, and for those that we've been able to add to it. So let's start with vaccines. And first over, remember, this is the December schedule of shipments that have almost all have arrived. We're still getting some from that very last week of December 27th and 31st. Part of this that we have to track is the federal government ships it directly to the providers that we indicate. It's actually working pretty well. It solves anybody from being a middleman, and it makes sure that they are shipped pretty quickly to those that can store it. And it should be helping us to get them out faster, something that we are addressing in real time. We have an update on the January shipments. So we showed you yesterday, the week of January 4th, and Pfizer allocation being 27,300. These, again, are first doses. That doesn't include the second doses that we've started getting for people's booster. Remember, it's one shot and a booster. Don't believe Facebook that you only need one shot. You need them both to get that 95%. And to those that think that we should use the second shot for other people and not use it as a booster, the CDC says don't do that. The FDA says don't do that. And the manufacturer says don't do that. So we're going to do it right. And the new information today is in the system, Tiberius. That's where the federal government puts in the new allocations. What we can expect next week are 27,300 from Pfizer, and Moderna 26,500. And these are all, again, first doses. So this raises one of the challenges that we have right now. So we'll go back through the priority list in a minute. But some people say, okay, if I'm in phase 2 or phase 3, what date's that going to begin? Well, right now we're only receiving the information about how many doses we'll even have a week in advance. And without a full guaranteed schedule, and also knowing what other vaccines may be approved and how much is going to be available, there is a limit to how far out we can project. Now, the Pfizer number has been consistent. for a couple weeks. It may be that will be our regular weekly amount, but we got to wait to see that. We'll also have more available as we get through the full long-term care program to push out as we work through all of those phases. Total doses administered in Kentucky. This number is better than it was yesterday, 66,582. That is an increase just from yesterday of 6,168. I think that makes yesterday, and remember, you have 24 hours to report the vaccination. So, and this is collected about noon every day. So it may be even a day behind. We believe it is at least a day behind as we get everybody on that reporting within 24-hour schedule. But still appears to be the most doses of vaccine administered in a single day. And it does suggest our call to urgency is making an impact even in just the first day. That is a hopeful sign. And in just today, Walgreens was in 11 long-term care facilities. They vaccinated 220 staff, 546 residents. And in good news, they believe that they're going to finish their allocation of long-term care facilities as early as this week for the first dose. They'll have to go back for the booster. CVS today vaccinated in 10 facilities, 1,423 doses. So that's just the long-term care piece. Again, on Thursday, we're going to get a specific update on the long-term care vaccinations, where whether it's Secretary Friedlander or Adam Mather will walk through how it's going, and then also give a resource for anybody who hasn't gotten a call from either CVS or Walgreens. At that point, we'll be ready to step in and connect you to make sure that everybody is on this schedule. So it's picking up, and that's good news. Obviously, it has to pick up more. I will say that many of us spent most all of today addressing the issues that we have in the speed of even 1A, which is healthcare workers and long-term care, 1B, making sure that the logistics are pre-planned, and that we have the structures in place that we're going to need to do significantly more vaccines, probably at some larger locations. So please know that this is mission number one for your executive branch of state government, and we're not going to let any noise or other things going on remove our focus from working to get this to you as quickly as possible. I want to show you the phases again that we talked about yesterday. Right now, we are in phase 1A. That's long-term care residents and staff. Remember, they make up over 66% of all of our deaths. They have to be the highest priority, as well as healthcare personnel. Now, we are hearing that there are certain healthcare workers that might not be directly in hospitals or directly dealing with COVID patients that haven't gotten a call or a schedule yet. We're working on that right now. Remember, we believe that 1A will go through probably the end of January. And so we're working on the communication piece to make sure that those that are receiving it in regions are reaching out. Dr. Stack was on a call with those facilities today. So it's coming, but please have patience with us. Remember, if you get this in the first month and a half, we need you to set a good example for everybody who's going to have to wait longer. 1B, phase 1B, we believe will start February 1st, plus or minus a week. We hope that it starts a week earlier. And that is as far out right now as we can project on precise dates, because we only know through next week the allocations of vaccines that we are getting. But we believe that this is a group that if we are organized, that we can really work through. 1C is a much larger group, by which time our infrastructure will have grown. And we anticipate that we'll have a significant number at that point of even drive-through vaccine operations, where you will be able to schedule an appointment. We'll be able to work those through 60 and older, and those that have the CDC highest risk conditions, and all essential workers. You can go to our website, kycovid19.ky.gov, and see how the CDC describes the highest COVID-19 risk conditions and who falls in essential workers. All of that is online, set out in detail. 2, 3, and 4, it's going to take us some time to get, but are those that, for the most part, are able and through their bodies to deal with COVID without certainly the deadly or the deadliest results. So 1A we're in right now. 1B, which is remaining first responders. Remember, EMTs and EMS are in 1A, but remaining first responders, anyone 70 and older, K through 12 school personnel. That will help us get our schools fully open and operational a lot faster and not put those that are in the buildings right now at significant risk that we would see if we went to a full capacity, full day, every day right now. That would be, unfortunately, that would likely put people at real significant harm. All right, today's report. Again, it's going to take at least a week to figure out if the numbers from the last couple days were inflated because they were lab reports coming in, or if we're just going to see vacillation in the numbers for a couple days. Because today we're reporting 1,781 new cases of COVID-19. That's our lowest Tuesday in weeks. Hospitalizations up slightly, 1,760. ICU and ventilators both down. Kentuckians in the ICU, 430. Kentuckians currently on a ventilator, 215. That's just barely down. Positivity rate, 11.4%. Again, that's cause for concern, but it's going to, again, take a little bit of time for us to see the data on exactly what the causes are. We have now vaccinated over 3.5. We have now tested over 3.5 or provided more than 3.5 million tests. I can't wait until the day that we provided 3.5 million vaccinations, because the day that we have gotten through that is the day that we'll reach the type of numbers we need to forever, we hope forever, defeat this virus. New cases by county: Jefferson, 314, Fayette, 143, Warren, 72, Kenton, 65, Davis, 53, Boone, 49, Laurel, 44, Bullitt, 41, Boyle and Hardin, 31, Lawrence County, 30, and the rest can be found on kycovid19.ky.gov. Now, we do continue to see significant number of deaths that still primarily relate back to that period of exponential growth. But even 1,781 cases is too many people when a certain percentage of those aren't going to make it. So let's continue. Even if we see numbers like we do today, I anticipate we'll see some higher numbers than this. Let's continue to try to push them down, because every amount we're able to decrease cases, we unquestionably save lives. So today we've lost 23 additional Kentuckians. Those are 23 families that need your help. I need you to light your homes up green to show compassion, and it's the color of renewal. I need you ringing the bells at 10 a.m. every day. I need any other help and support that you can give them. This is a tough way, a difficult way, and an emotionally challenging way to lose a loved one. And whether it's being able to see them before they pass, or whether it's how you're able to celebrate their life in a funeral. So let's make sure that we don't wear down in terms of our compassion and being there for each other. The loss today include a 69-year-old man from Boyle, an 87-year-old woman from Caldwell, a 68-year-old man from Fayette, an 86-year-old woman and a 63-year-old man from Harlan County, 85-year-old woman from Hickman County, an 85-year-old woman, a 92-year-old man, and a 97-year-old man from Jefferson County, a 95-year-old woman from Kenton County, a 62 and a 67-year-old woman from Laurel County, a 78-year-old man from Logan County, Pulaski County, 7 individuals, and this may be as they were reported in, and then I went through our process, though it looks like all but one passed away in December. So in Pulaski, an 85-year-old woman, an 89-year-old woman, a 91-year-old woman, a 94-year-old woman, a 63-year-old man, and a 97-year-old man. That's a lot of loss for Pulaski County. We're thinking about you. Also, a 90-year-old man in Russell County, an 86-year-old woman in Wolfe County, and an 81-year-old man in Woodford County. Long-term care, again, these are heartbreaking numbers to show every day, shows why that vaccination program is so important. 113 new residents testing positive, 118 new staff, 72 additional deaths attributable to long-term care. Once we have these facilities vaccinated, we're gonna save so many lives. So thank you to everybody out there being patient and knowing that this is where vaccines need to go first. All right, we've got Mark Carter, who's put together a presentation about the great work of our contact tracers. You know, it worries me that contact tracing got caught up, it seems, in a little politics, about steps we had to take that worked to stop the first 2 waves. And in the 3rd wave, they certainly put a dent in it, and we hope that we've defeated that 3rd wave. But again, it's always fragile depending on our behavior moving forward. But I think our contact tracers who've been doing really good work got caught up in either attacks people wanted to do, or again, just trying to question things that every expert says are the reality and the truth of this virus. So this is an opportunity, I think, for Mark to talk about the really incredible work of another group of heroes that have been out there working to protect people every day. Mark Carter.
Well, thank you, Governor, and they really are heroes. I guess just to get started, I'm pleased to be able to give this update. I think the focus of late on vaccines is exactly as it should be. After all, that's the hope that we all have, that we will get past this pandemic and we'll get past it in the coming months. And still, at the same time, we've got to be careful until we are all vaccinated and we're safe from the pandemic and from COVID-19. And so that means doing the things that we need to do, both personally in terms of things like wearing face coverings, taking care of our hygiene, keeping a social distance, et cetera. And we also need to continue to participate in the disease investigation and contact tracing efforts of our local health departments. So with that as sort of a prelude, if I could get the slides shown here, and I'll walk through this. This probably looks familiar to everyone that has listened to my updates previously. On the left side of that slide, you can see the numbers in terms of our staff. We have added over 1,200 staff over the course of the last 7 months or so, as you can see there. And you can see the breakdown between contact tracers and investigators. These folks, again, are dispersed across the state in our 61 local health departments. And they're the folks that are doing the work every day that are making this effort successful. On the right side of that slide, just some numbers. We have 61 health departments up and running on our system. The one that isn't will be up and running shortly. We had an allocation of about $78 million, or a budget of $78 million for the disease investigation and contact tracing effort. Through the end of December, we've spent just short of $48 million. So I think we've been good stewards of the money. It is federal money, but we still have the same obligation to manage that carefully, and I think we've done a pretty good job of that. You can see down there almost 48,000 K through 12 students quarantined. And our data that I'm showing you is really just from about the end of September, 1st of October. So that's a very significant number. And, we clearly prevented disease and likely saved lives as a result of those efforts. We could go to the next slide. Again, just to emphasize that our data is really complete since about the 1st of October. So this really represents almost the entire fourth quarter of 2020, just before Christmas. So as you can see across the top here, we have some data parameters. We believe from our data that the folks identified as contacts would essentially convert to a case, meaning they became infected while in quarantine at a rate of about 16% from the data that we have. And then our data from the fourth quarter shows that the number of contacts per case is about 1.5. Now, we think that that is probably low for a variety of reasons. We were seeing larger numbers earlier in the year, but because of some of the challenges that we've had with the program, we think some of the reporting there may be suppressed. That doesn't mean people aren't isolating and protecting themselves and their family. It just means that we only know about 1.5 of them per infected case. And then across there, just a few stats, 36,000 Kentuckians that were successfully contacted and quarantined. That accounted for about 54,000 contacts who were quarantined after being exposed to someone who had the virus. 167,000 cases that were successfully isolated using from our system and that had tested positive for COVID-19. And again, this is another statistic that is skewed towards the fourth quarter, but 32% of those were successfully contacted by a contact tracer or an investigator within 24 hours. We think that percentage was considerably higher earlier in the effort, but in the fourth quarter is when we started to see the really rapid growth in the infection. And that, along with some other factors, I think have limited our ability to get to as many people as we would like within 24 hours. 213,000 Kentuckians were successfully identified as needing quarantine, and we think about 57% of those were potentially exposed to COVID and then successfully quarantined. So if we could go to the next slide. So as just to summarize some of the information we're seeing in our data, we, as I mentioned previously, of the folks that we've actively identified as a case through our tracing process is about 90,000 people. About half of those were folks that were quarantined, and given that and a conversion rate of the number that become a case, we think there are about 450 potential deaths that were prevented. We have a 5.2% hospitalization rate. If you do the calculation on that, we think there were almost 1,700 almost 2,400 potential hospitalizations that were prevented, and around 1,700 ICU beds that we kept people out of as a result of the effort. So if we could go to the next slide. I'll probably harp on this a little bit, but our data, as I said, is somewhat limited. It took us a while over the summer to get all of the health departments onboarded onto the system. We've had, as we've talked about before, a number of challenges to our data gathering and data reporting. These are some that are highlighted here, just the decentralized nature of our public health infrastructure and the fact that most of this data for years and years has been tracked in the local health departments and then reported up to DPH through somewhat labor-intensive processes, I'll say. And so part of what we're doing is trying to centralize all that and address that data limitation. We had a delayed rate of adoption, as I said, from some of the health departments. As the surge occurred, that's really challenged our contact tracers, and we had to make adjustments around priorities of who we call and who we just rely on the case to inform their contacts when they're lower risk. So we think we have some underreported cases and contacts. That can occur just because people are afraid of the impact that having to quarantine or isolate might have on their life, their livelihood, their job, their kids, and so forth. And then finally, the politicization of this has been really troubling, and I think has limited people's participation. We don't have the participation that we really want across the Commonwealth, which frankly for me would be 100%. The upshot of all this is that just because of all these reasons, the numbers I'm going to show you here, I think are probably very conservative and maybe understated. We tried to really just focus in on our data and not try to make assumptions too much around what might occur in a couple of years. I'm sure that our epidemiologists in the Department of Public Health and probably our two public health schools in the Commonwealth will do exhaustive studies. And it's an informed opinion, but it is an opinion that those studies will show that the tracing effort saved many, many lives and many hospitalizations. So if we could go to the next slide, let me just show you what I'm talking about here. This slide just is an illustration. I borrowed this from the Louisville Metro Health Department, so I'll credit them for this. I'm sure that they borrowed it from someone else, but for these purposes, we'll give them the credit. And this just shows how, one person being infected through their contacts and daily activities can lead to an exponential growth in the infection. And it also shows how decisions that we make can have a real impact on this, personal decisions that we make. So, I decide I'm not going to go out to eat at a restaurant on a particular night after I'd been, potentially exposed. I didn't fly domestically and so forth. And that's how we break the chain. And so if we could segue to the next slide, what I'd like to show you is just how this could, and why I think that these numbers are understated. So if you start at the left side of that slide, you can see that we have 54,000 potential contacts that we know about, that we can then calculate the number of hospitalizations that are prevented, the number of deaths prevented. We came up with a $19 million number for hospital costs saved. That number is a function of the number of hospitalizations and the cost per hospitalization. We counseled with the Kentucky Hospital Association to get that number. And so you can see there, that's pretty meaningful right there. 300 deaths, what's that worth? But look at what happens as you move across that slide and follow that chain of growth in the infection. So I think that based on what we can document thus far, it's pretty clear that the program has been successful. I think that studies down the road will bear that out. But this is just intended to be an illustration to show the viewers how this disease could have impacted our Commonwealth in such a significant way. So if we could go to the next slide. So just a quick summary. Contact tracing, as you can see, is very effective. We have limited exposure for Kentuckians. We provided a lot of support to them, both in terms of helping them stay healthy, but also social support where folks, may have had difficulty getting groceries or childcare, their medicines, assistance with their employers and the like, reduction in hospitalizations and deaths. So again, the summary there, 450 lives saved, 54,000 Kentuckians that were quarantined and monitored for symptoms, and $31 million saved in hospital costs through a $47 million expenditure CARES Act funding. So it's effective, but it does require the participation of all of our citizens of the Commonwealth. And I think, and that's the participation that we have had has been very successful. So last slide, and I'll finish up here. Again, just to emphasize that while we all are anxious to be vaccinated, and I include myself in that group, until we can be, we have to continue to do the things that we just sort of harp on in terms of wearing a mask, social distancing, getting tested if you feel sick, taking care of your hygiene, and participating in contact tracing. And if we can do that, we'll get to the vaccine and we'll get through this pandemic. Just as the governor said, we'll get through it together. So with that, I'll stop and turn it back over to Governor Beshear.
All right, thank you, Mark. We'll have Mark on the line for questions, as well as Dr. Stack, who's on the line for questions. We have a medium-sized group of journalists on the line, as well as just a couple of written questions. So let's start with Corinne Boyer from WEKU.
Hi, this is Corinne Boyer from WEKU. How much pushback are contact tracers getting from people they contact, and what does the state plan to do to encourage and educate people about why they should participate in contact tracing when some people have been hostile and even threatened public health workers?
Let's go to Mark for the first part of that question, and I'm happy to help with the second.
Yeah, I do think it has been an issue that there has been pushback across the Commonwealth, and in some cases, unpleasant interactions with the contact tracers with individuals. But overwhelmingly, though, once our staff have been able to talk to people and help them understand exactly what they're at risk for and what they can do to prevent or to protect themselves and also to protect their loved ones, they're generally cooperative. I think the biggest challenge that we've had of late has been less of the hostility towards the staff as just the overwhelming numbers. I mean, we just are having trouble reaching people. We made the decision in situations that we judged to be lower risk that we would simply let the person who had the infection notify their contacts and tell them what the public health suggestions were for them to quarantine. And we just tried to focus on the disease investigation itself and the highest risk contacts. If it were someone in the household, for example, that had, multiple health conditions or elderly or things like that. But not to minimize it necessarily, it has been an issue, and I think it has been a challenge for our staff. But I do feel like, I think the feedback would suggest that it is a minority of people, a smaller percentage. They just tend to be louder and noticed more in the environment that we live in today.
And let me be a little blunt. At this point, after losing over 350,000 Americans, after losing more Kentuckians to COVID-19 than we lost in World War I, Vietnam, or Korea, if you are still not believing it's real, if you are refusing to quarantine, if you are positive and you go out, then you don't care about other people. I know it's a small group, but it shouldn't take somebody in your immediate family contracting it or dying, or it shouldn't take you getting it at this point to care enough about people around you when, in LA County, they have so much COVID that ambulances are no longer doing runs for those in the worst shape. I mean, we're at war, and either, you do your patriotic duty and you support this country and you support this state, or you don't. And I think a lot of people, not a lot of people, I think that small group of people that are being so reckless with other people's lives are going to be really ashamed in a year or two as we look back on this. But we focus so much on those doing the wrong thing, we don't give enough credit to all those out there doing the right thing. And we focus, and it's understandable, whether it's media or outside or on social media, on the negative. There is so much positive in what people are doing. There are healthcare heroes, there are the contact tracers, there's everybody doing it right every day. And I do want to make sure that I emphasize how many people are out there that have been fighting this war day in and day out next to their neighbor and protecting one another. Josh James from WUKY.
Thanks, Governor. First, I know you probably haven't had time to look through all the priority bills Republicans are filing, but from what you've seen today, what are your top concerns about that legislation? And also, I want to get your reaction to the protest signs at the Capitol today calling for your impeachment, and at least one saying, "Make hanging traitors great again." Do you have any further information on those? Thanks.
So I think today there was a rally where online they were trying to get hundreds or thousands. They had about a dozen. They were outnumbered by yard signs. And Josh, I'm just not intimidated by yard signs. The bills filed today, I will tell you, I've spent my entire day on addressing this vaccine rollout, making sure that it's working better today, and doing the absolute essential planning for tomorrow. That's my number one focus, regardless of what's being passed. So I haven't heard a single floor speech, and I haven't read the text of any of those bills yet. I think my focus is where it should be. And every other minute has been on the budget that we're going to introduce tomorrow night that is going to give us a chance to help people right now and a chance to be a leader in the post-COVID economy. It is an opportunity either we are going to take and run with, and future generations are going to benefit, or we're going to fumble by watching other states pass us by. The bill on limitation of emergency powers, at least from what I've heard, is unconstitutional. And then there's one, I think that's something about, and I haven't read it, businesses only having to comply with CDC guidelines. And I really hope they dig down, because which CDC guidelines? There are dozens, if not more, on the website. They are changed regularly. They're not all clear about what's a mandate and a recommendation. It'd be taking very explicit executive orders that you can read and understand who's involved, and replace it with something nebulous that you got to Google to go out and find. It doesn't give a lot of protection either for individuals or for the business itself. It wouldn't work. All right, Tom Latek with Kentucky Today.
Good afternoon, Governor. I was exposed to someone at the Capitol last Monday, and I was contacted by that person's office the next day, but I was never contacted by a contact tracer. How do you determine who does the contacting?
So where we are right now, and Mark was talking about this, is overwhelmed is the answer. It's that we have so many cases coming in that the health department or the contact tracers, when they are talking to the individual, they first talk to them about taking care of themselves, what it means, what they shouldn't do. And then they talk to them about the exposures that have been there. And we're asking a lot of people right now, I think including that individual, especially those that we know will get it done, to make some of those calls themselves, because otherwise we can't reach other people. It is imperfect. No question. But the challenge is just the overall numbers that we are seeing. And Tom, you're always wearing a mask, which I appreciate. And this is beside the question, but even wearing that mask, I know has protected me. And I certainly think it's going to protect you. And I appreciate the example that you've set day in and day out by doing that. Make sure you monitor your symptoms. And we all want you out of quarantine as soon as possible. Catherine Collins from WLEX.
Thanks, Governor. I'm wondering if long-term care partners, Walgreens and CVS, have responded to the offer to increase their teams for vaccinations. And is there any effort to train more people to be able to administer the vaccine?
So we are working through right now. There were calls today with Walgreens and CVS about our offer, especially for National Guard, to help expand their teams and speed up the vaccinations. I think we're looking at a model, I think, done in West Virginia, and looking through how we can get that done. Catherine, the second part of your question. Did I miss the second part of the question?
It was,
Well,
yeah.
Go ahead.
It was, is there any effort to train more people to be able to administer the vaccine?
My apologies. We are looking at what the other opportunities are, especially as we look at different partnerships that are out there. Our biggest challenge isn't the actual individual who administers the vaccine, though we got to have enough because it is fairly time intensive. It's scheduling the appointments so that we don't have long lines. It's the IT reporting system that connects with the federal government and gets it in. It's the ability of wherever you are doing it to get large numbers of people through. So it's not as much as the medical administration, but the underlying logistics of it and doing it in a way that doesn't expose people. You look at what Louisville is kind of beta testing right now in a drive-through facility, and you see that we can bring enough people together with the right partnerships to give them, but directing people to a specific place, getting it scheduled and planned, and protecting people from COVID as we do it is the bigger challenge. And then it's going to be the distribution of the vaccine to areas that can administer it quickly, like we're looking for. Chad Hendrick from WSAZ.
Hey there, Governor. A quick question in terms of, we here in Martin County in particular, they were set to have a 3-day vaccine clinic. They canceled the last 2 because they ran out of the vaccine on the first day. So are you looking at where these unadministered doses of the vaccine are in the state and then looking at maybe redistributing them to other areas across the Commonwealth?
So a lot of the undistributed vaccine is in our long-term care program, and it's designated for that, and it is going to get out. The other piece is pretty much designated for a specific healthcare worker. It just hasn't been provided with as much urgency. But what you're describing first is a real positive by the group that's doing that. It means that they are acting with urgency, and we appreciate it. What we're going to be looking at moving forward are groups like that are getting it out quickly and effectively, and trying to provide them more vaccine as the allotments come out, especially if they are able to strictly follow the tiering. So what we're seeing in performance right now will help us make those decisions as we move into the future. I think we're going to see our numbers pick up significantly, but we still have a lot of infrastructure to build if we're going to do 1B and especially 1C as fast as we need to. Shelby Smithson from WKYT.
Hi, Governor. For vaccine distribution, specifically in rural areas where doctors' offices and hospitals are more scarce, so to speak, what kind of providers will be utilized in those areas, especially in future phases?
So we're working on those partnerships right now. So if for 1A, and remember in 1A, the long-term care is already provided for by Walgreens and CVS. In the healthcare provider, we are connecting those hospitals and other groups that have vaccines, letting them know the region, and we're working on connecting them to all the other healthcare professionals there. We're doing that in real time. As we look into our future and we are vaccinating significantly more people on any given day, we're going to have larger regional sites in every area of the state, which means we're going to ensure that within a certain drive, No matter where you are in Kentucky, there's going to be a facility, a drive-through, a hospital or other provider, a local health department that has the capacity and the IT infrastructure that's going to help get you through. And we're going to make sure we have that all at the same time across the state. If you think a little about how our Kroger drive-throughs came together and then how we were able to emulate that in other areas of the state, we're looking at some of the state models, though with partners we're looking at right now, we want to make sure they can immediately stand up the number of facilities we need. And now we have funding for it. So looking back, one of the major challenges here is the federal government didn't provide us funding to build infrastructure to provide this vaccine to people until after the vaccine started rolling out. I mean, in any organized way that we would have done this, the federal government would have provided us with dollars to build our infrastructure a month before we got the vaccine, or they would have done it themselves in a different way, like surge testing. So in many ways, we just got the funding to fund the partnerships now, several weeks after the vaccine. But we're going to get it done, and as we get more vaccine in many ways, we've been able to learn lessons early, which is going to help us later, and I think is ultimately going to speed up everybody getting this vaccine. Melissa Patrick with Kentucky Health News.
Hi, Governor. With the latest recommendation for schools to wait until January 11th to reopen, and that date coming up next week, do you think with the high positive test rates and other than today, those surging case numbers, that it is still safe for Kentucky schools to reopen?
I believe on the 11th, which gives a little extra time to see what happened over the holidays, and for people that develop symptoms to be tested and to be quarantined. The 11th will be safe for our schools to resume in-person classes because I believe they're open, but virtually for this week, if they meet all the requirements in the executive order and follow all best practices. If they have reduced capacity in the facility, if they've provided an accommodation for all of the school personnel that fall into the danger zone, if they have true, real virtual options for their student that gives real choice to families. I believe if all those things are done based on some of the evolving research, then yes, it can be safe. But every school and every school district is going to have to closely monitor what they're seeing in their community. And they can't be afraid if things get bad with number of students testing positive or staff and students quarantined to make the decisions that they need to make. Now, I do believe that will happen. While at different times I've had criticisms, I believe our school districts have really watched the data and at different times, for the most part, tried to make wise decisions based on what we've seen. But I believe if we follow the requirements and try to improve every day, then I believe that it can be as safe as we can make it in COVID. It's also really important to get our educators vaccinated as quickly as possible, and that's why we've prioritized them. Sarah Ladd with the Courier-Journal.
Yes, thank you. I had a clarification question about the vaccine rollout and adults who have intellectual and developmental disabilities who might live in congregate settings or with elderly caretakers. Would someone like that definitely fall under C, or is there any space for them in the long-term care category? And then plus, as part of that, is the state looking at that population specifically when it thinks about vaccines and COVID-19 plans in general? Thank you so much.
Thank you. Let's go to Dr. Stack on that one. I think we've got him.
And vaccinating that population. Can you hear me okay, Virginia? Wonderful. So following the CDC guidelines, individuals with special medical needs fit into category 1C or beyond. And so, or or the huge part of 1B in the ACIP guidelines. So the short story is people who have special medical needs would fit in our paradigm in category 1C here in Kentucky, and that would be anticipated to start later in the winter. And Governor, I apologize, but I think I'd need to know the second part of the question, which I didn't hear clearly.
Can you bring me in? It's in if they were potentially considered in long-term care, which I think the answer to that is no, though we do have some institutional settings, congregate settings that I think we've been able to start dealing with separately.
Correct. So this is one of the challenges. There are some behavioral communities that are included in the long-term care vaccination program that are part of the CVS and Walgreens scheduling. But we found there are a small number of other communities that weren't included in that, and that'll have to be part of the process as we identify them, that we make efforts to reach them and find ways to get them vaccinated. So yes, we are paying attention to that, and it's part of this build-up process to make sure we reach all the vulnerable populations.
Written questions, 2 on the timeline of the vaccine rollout. Again, 1B, February 1st or earlier. 1C, we're just not able to put a specific date on yet. We want to get to it as quickly as possible. But right now, all we know is how much vaccine we will get next week. Now, if we start seeing that the Pfizer allocation is the same each week, because this next week is the same as this week, and the Moderna is a little bit different, if we can start seeing some consistency in that, we'll be able to project out better. But with only knowing 1 week in advance and us really only being, 4 or so weeks into receiving shipments, we've got to get a better number. And then it can totally change if, say, AstraZeneca, if that vaccine is approved. That may change all of the numbers we have and allow us to increase the speed. There's also the Johnson & Johnson vaccine. So the number of variables from distribution to number of vaccines to amount manufactured. Let us project right now 1 phase ahead, but not 2. But again, we do this 3 times a week, and as that information evolves, we'll want to provide it. Question on long-term care facility cases and whether they're being, what do we do to ensure they're reported correctly to the state? Concern about one facility in Trigg County that confirmed an outbreak of COVID-19 on December 16th, but worries that it's not been published on the long-term facility update. So the team at the Kentucky Department for Public Health works with local health departments, regional epidemiologists, and regional infection preventionists to ensure that outbreaks are reported in a timely fashion by long-term care facilities. In April, we created a daily survey to assist facilities in reporting that those facilities are supposed to use. The Office of Inspector General at CHFS has a mandatory reporting electronic platform that is sent daily to track new cases. And so there is certainly that system set up, and we will check on this individual facility. We do appreciate it being brought to our attention. All right, folks, just because we're in day 1 of a General Assembly and people are putting up silly yard signs isn't going to change what I'm focused on. I'm focused on you and your safety during this pandemic. This is most likely the most important thing I'll ever be called upon professionally to do. So I want you to know I'm not going to lose focus. I'm not going to lose focus on saving lives. You, the people of Kentucky, we're in this together. Our decisions impact one another, and I'm going to tell you that I'm going to give you my best, as will my entire administration, each and every day. Now, the challenges we face now, and that's everywhere from trying to encourage the best behaviors, convincing some people that this thing is real, saving lives, to the logistics of the largest distribution of vaccines in the shortest period of time that we've ever been asked to. We're working on it daily. It won't always be perfect. In fact, early on, it'll be less than perfect. But we're going to improve. We're going to improve. And we're going to improve, because I want to get this vaccine to all of you that want it as quickly as we can. I wish I could tell you it's going to be tomorrow, but we are going to make it happen. And I'm not going to be satisfied. Not today, not tomorrow. Probably not until the last person gets it. That's the type of person I am. Until we know that we have made improvements each and every day. And those are the instructions that I've provided to everybody working on this. 2021, it's going to start tough, but it's going to be the year we defeat this pandemic. And that's going to be an incredible accomplishment by every one of you, by every Kentuckian. Tomorrow night at 7, in a combined State of the Commonwealth and budget address, I'm going to lay out my blueprint for how we provide relief to those that are struggling. And we can't wait to do that. How we prioritize our people and how we make bold investments in our future. We don't just have to help our people get through this virus. We have to establish our place in the post-COVID world, in the post-COVID economy. Other states are going to clamor. They're going to do what it takes to make sure they leapfrog other states in a world that's going to have more remote work, where density isn't going to be as important. Kentucky's going to have more chances than ever before, but only if we're willing to grab that ball and run with it. If we refuse to get off the bench, if we simply take a knee, or if we fumble the ball, our people lose opportunities. This is the time, this is the year, and after everything we've been through, why would we stop struggling for a better future? We fought for each other's lives. Now let's fight for the lives of the next generation and how incredible they can be. This can be the generation that not only went through and defeated COVID, but moved Kentucky forward in special ways. That can make us a very special generation. I don't know about you, but that's exactly what I want to be a part of. I hope to see most of you 7 p.m. tomorrow night on KET or on our social media for our State of the Commonwealth. And then I'll see you again on Thursday with our COVID update. We're going to get through this. We're going to get through this together. Appreciate you, Virginia, everybody who is watching at home. Let's take care of each other. Let's also build towards a brighter future. Thanks.